Oh, okay. I am opening the patient's chart, checking for patient name and orders, which is heart and lung assessment, and closing the patient chart for HIPAA. Knock, knock, knock.
Hi, come in.
Hi, how are you today?
Good, how are you?
Good, thank you. My name is Stephanie. I'm going to be your nurse today, a student nurse from Valencia College. Okay? Can you confirm your first and last name for me?
Elizabeth Wheeler, 120602 is my date of birth.
Okay, perfect. Beat me to it. And do you have any allergies that I should be aware of, Miss Elizabeth? Okay, and are we feeling any pain today?
No.
And on a scale of 0 to 10, how would you rate that pain?
0.
Great. So my name is Stephanie, like I said, and I'm going to be conducting a heart and lung assessment. So I'm going to be listening to your heart and lung sounds today and then palpating for some pulse points along the way, okay? If you have any questions, just ask, okay? I'm going to get started by checking your brachial pulses. Okay, and then radial. Okay, and then let me just check your capillary refills. Okay, and those are appropriate, all under 3 seconds, and your pulses are also great. Okay, I'm going to check behind your knees for your popliteal. If you could just flex your feet for me. Great, thank you. Okay, and then posterior tibialis. Great, and then dorsalis pedis. Okay, and then since your toes are pedicured, I'm just checking the capillary refill by pressing down on the front, and it is appropriate. Okay, now next I am going to be palpating your carotid artery. For this, I'm just going to be doing one side at a time so I don't compromise any blood flow to your brain, okay? I'll go ahead and get started on this side. Okay, any tenderness when we press back here?
No.
Okay. Good, so no masses or lesions noted. So now I'm going to go ahead and take a listen. I'm going to start with your carotid, and I'm going to listen to your chest, and I'm going to spend 1 full minute down at the apical pulse, okay? All right. And then do you mind lifting your shirt? Perfect, thank you. Okay, perfect. So everything does sound good. Now, if we did hear any murmurs, we would be reassessing those 5 positions in the sitting, laying, and left side laying positions, but everything sounds great, so I'm going to go ahead and listen to some lung sounds, okay? Alrighty, so I'm going to go ahead and just check for any masses, any tenderness. No? Okay, and I'm not noting any lesions either. All your heart sounds were great, so now let's make sure your lungs match. So let me go ahead and take a listen, okay? Do you mind lifting your shirt for me? Perfect, thank you. And can you go ahead and take a deep breath for me? Perfect. Good. Again. Okay, and one more for me. Okay, all right, and then just go ahead, I'm gonna test one thing here. Can you go ahead and say 99?
99.
Okay, one more.
99.
Great, and your respiratory rate was at 15, which is great, okay? So now all the sounds in the front sound good. I'm gonna check the back sounds, okay? All right, I'm just gonna do a little percussing up here. Perfect. And resonance was noted. If you don't mind lifting your hands again, or your shirt, thank you. Alrighty. Take a deep breath for me. Okay. More. Okay. Again. Inhale. Good. Again. Again. Okay. One more. Okay. Good. And last one. Okay. Perfect. So I'm not noticing any labored breathing, no pursed lips, no use of accessory muscles or intercostal muscles. Any questions for me?
No.
Wonderful. So everything checks out well. So the doctor will be in shortly. Your call light is right there on the side if you need anything, okay?
Thank you.
Thank you.